What's going on, guys? Dr. Greg here. Today we're going to talk about how to properly activate some major core muscles prior to lifting heavy. So one of the main things I see with people with low back pain is that they've just never been taught how to contract their core the right way. For a long time, we taught in the physical therapy and the fitness industry, we taught that we need to bring the belly button towards the spine. And if that's what you're doing and you're having low back pain, that may be a big reason why. Bringing the belly towards the spine, if you're taught the correct way, might be what you need to do. But a lot of time what happens is you don't use the right muscle, which is the transverse abdominis muscle. And you start to really tense too much and the obliques kick in, and then we have too much pressure and we're not even doing anything to stabilize that lumbar spine or prevent excessive compression through that spine. So let's go over what you should kind of be thinking about and how to properly tense the abdominal muscles to stabilize the midsection and increase what we want, which is intra-abdominal pressure, which is good to avoid the discs taking on all that pressure and those tissues breaking down over time, especially when we're doing repeated squats and deadlifts in the gym, which again, we should be doing repeated squats and deadlifts in the gym. But if you're not doing this very simple prep movement prior to getting that bar up or prior to going down into a rep, then your spine's taking way too much force. And no matter how many planks or sit-ups or whatever you're doing for your core routine, it's not going to directly translate to the squat unless you learn how to properly activate these muscles. So what I want you to do is take your fingers, go to the belly button, and then go to the side. And I want you to put a little pressure into your belly. What we're looking for is when we properly tense these muscles, you should feel muscles pop out into your fingers, not go away as if we're sucking in the tummy towards the spine. So really what you want to think about is the term bearing down or Valsalva maneuver. When powerlifters lift heavy, they hold their breath and they create pressure so that they don't have injuries and that they can lift more weight efficiently. And we want to be able to do that without necessarily holding our breath. I think there's a fine line there. If you're lifting super heavy and you're competing at a high level, then that's a technique that we can go over. But if we're just trying to gain strength and work out and stay fit and stay healthy, then the breath work comes into play. And then we can have a whole nother freaking 2 hours on breath work and how to properly breathe. And that goes along with stabilizing the spine and how the diaphragm's working. That's a whole nother conversation. Today we're just going over how do we properly contract these muscles. So like I said, belly button, go out to the side a little bit. And what you want to do is you're trying to push the fingers out, but I don't want to just push out. I want to think I'm lowering my rib cage towards my pelvis. And you can see when I do that, my fingers are moving out, my hands are moving out, right? Now, the other kind of cue I give is you want to feel like you're bearing down, like I said. So we're going to get a little personal, but if you're constipated and you're trying to get something out on the toilet, what would you do? You're going to, and that's the Valsalva maneuver, and I'm holding my breath and I'm using my diaphragm to help create that pressure and create that tension. I want to try to do it by just activating this muscle in isolation. So think ribs down, think like you're about to expel something out the other end, but don't hold breath, okay? So we're here, I'm pushing my ribs down, I'm feeling the tension in here and across my pelvic floor, but I can still breathe while I hold that. So you want to practice this in isolation, then take it to literally every heavy lift you're doing, whether it's upper body or lower body. We should be tensing here to protect the lower back. And if you're missing that key component, that could be all we need to prevent future spine injuries and disc issues, which are all too common in the fitness world, and especially even out of the fitness world because people are too sedentary. But this is the way to prevent injury, especially during those heavy lifts. Try it out, practice it, get it to be muscle memory. It's a brain-body connection. That's what we're all about here at Movement Driven. We're trying to create a new muscle memory to change the way you're moving permanently, not just putting Band-Aids on boo-boos. So if you guys have any questions, reach out to me. If you're having back pain, you need help learning how to contract this, sometimes you need to come see us. So please reach out, let me know. There's no reason to be in back pain as long as you have been, which I'm sure has been a long time. So reach out, come see us. We'd be more than happy to help you. Good luck with this one, guys.